Okay, you're good.
Okay, great. Thank you. Good afternoon, everybody. Welcome to January Board of Health on this beautiful sunny but snowy day in Ithaca. Okay, so we're going to make a few adjustments to the agenda for today, just in terms of order, as we're waiting for some additional board members to join who are able to help with voting. So we reach quorum. So we do not have anybody for privilege of the floor, so I'll go ahead and skip that. We're going to hold on the approval of the minutes until later in the meeting, and we'll start with our financial summary and then move right into our reports. So Brenda, I think that means you're up first.
Sure. The December 22 or month 12 financial summary was included in your packet. As we've reported, I think nearly every month, we continue to juggle and try to balance out all of our COVID expense with potential COVID reimbursements, and that continues on through the end of the year and on into 2022. I was just looking at my report. We are still getting some year-end bills, so I can't tell you exactly where we are with the medical examiner program. It's going to be really close either way. We just got some additional bills in today, and I think I'm waiting for one or two more, and then we'll kind of have an idea what that picture will look like. We are in the midst of fourth quarter claims. We've been held back a bit by lack of payroll reports. They have come in mass since the changeover to the new payroll system. So we've had 4 or 5 payrolls to split and post, and are working very diligently to get that accomplished in order to file our claims. This is the time of year where our admin staff are really busy, and we're closing one year and trying to open the next year. And we have a lot of grant and financial documents that are required. So hopefully in another month or two, we'll be able to give you kind of a overall picture where public health stands at the end of 2021. A lot will depend on how quick we can then do transfers and adjustments as needed. So I don't have anything else to report at this time.
Great, thank you, Brenda. Any questions for Brenda on the financial information? Okay, let's go ahead and move into our reports. So Frank, you're up.
Great, thanks, Christina. And just to add some context to our quorum situation, Sue and Ed, unfortunately, we didn't get your names into the legislature in time for reappointments. So you can't vote today. Certainly you're welcome to participate in the meeting, but you won't count towards quorum or be able to vote. We will have you ready to go by February. My apologies that didn't get done timely. So updates, a little bit about COVID, and then I want to talk a little bit about the merger activities. Obviously COVID is continuing to dominate a lot of our time, but things are shifting. I'm sure by now you're aware that we have suspended our contact tracing operations, and by the end of this week, we'll have scaled back all of our case investigations and have turned that over to New York State for follow-up on positive cases. So we're really moving away from case investigation and contact tracing as a disease intervention mechanism and focusing our attention in other places. I do want to say every time I talk about this, kind of the reasons why, it's not because we're just giving up or we're tired of doing it. It is really that it has become less effective. And that's in large part because of the reduction in isolation and quarantine times to 5 days, as well as the infectious nature of the Omicron variant, which is the predominant strain in the community. So with folks being contagious earlier on in their disease presentation and the shortened timeframes for isolation and quarantine, in best case scenarios, we're getting to people on day 3, right, 2 or 3. And so there isn't a lot of benefit in dealing with isolation. And then subsequently quarantine, in best case scenario, we're getting to people on day 3 and day 4. And, at that point, their quarantine is virtually over. So it's just a matter of wanting to shift our resources where we think they will be more effective. And that's really about vaccines and education. So we've had a lot of vaccination going on. Every Saturday, we're offering booster clinics. We've done well over 3,000 people between the one we did in December and the ones we've done so far in January. We also are doing children 5 to 11-year-olds out in the school district. Tonight we'll be going to, or this afternoon we'll be going to Groton, and then Thursday we'll be going to Trumansburg. And after that, every district will have gotten an on-site 5 to 11-year-old clinic. We will be finishing second dose clinics for those into February. But at that point, that 5 to 11-year-old group will have been given opportunities in their communities for first and second dose. I do want to share that we are at about 50% of our 5 to 11-year-olds having a second dose on board. The state number is like 20 or 22%. So we are way ahead of that number. And I think we've met the demand in our community. Even when we're going out to the schools, generally speaking, we're doing 10 or fewer kids at those clinics. So I think for parents that have chosen vaccination for their child, they've found the opportunity to get their child vaccinated. We will likely be winding down our Saturday clinics after this coming Saturday. We just announced yesterday we'll be doing Saturday morning Moderna, Saturday afternoon Pfizer clinics. We do Pfizer because that's for 12 and up as well. We have lots of Moderna vaccine, so that's been our focus. But we are offering the Pfizer for the 12 and up group. And so lots of vaccination efforts going on. Also doing a lot of education. There's been several press releases. Sam and the PIO group are doing a lot of work on our website. First, getting it ready for migration over to the new, I'm not even going to pretend to understand it, but there's a new website platform that we need to be in. And I think we're one of the last departments to have migrated. And so we're in the process of doing that. And at the same time, reorganizing and improving upon the information that is on our website related to COVID. So a lot of efforts going there. We're also handing out test kits. The county has received 2 boluses of about 4,500 test kits. The first one out a couple of weeks ago. The second we'll be putting stickers on this afternoon, and they'll be getting out to local food banks and some municipalities and libraries in our communities. So look for a press release coming on that either later today or tomorrow. But those test kits will be going out. And of course, our schools are receiving test kits directly from the state, and BOCES is managing that effort to get those test kits distributed. Probably the big news of the day is the Nassau County judge that struck down the governor's mask mandate, particularly for school children last night. That's obviously created a little bit of chaos around the state on what that means and how it needs to be implemented. The state has filed an appeal, which is supposed to result in an immediate stay. We haven't gotten final information that the stay has been put in place, but the New York State Education Department sent notice out to all school districts this morning to say that they are required to continue to implement the mask mandate while the court process continues to unfold. There are competing court positions. An Albany Supreme Court judge said that it was constitutional last week. So there's competing issues in 2 different courts that will have to be rectified ultimately in the Court of Appeals at the state level. So more to come on that, but know that all of our local school districts are continuing the mask requirement in their schools as they've been directed, and plan to do so until they get different guidance. So that's the COVID update. Before I jump on to other things, does anyone have any COVID questions I can answer? Sue?
Yeah, I know higher ed is requiring students to get booster shots. Is the expectation that they get them before they come, or can students get boosters in this county?
Yeah, so no, they can get boosted anywhere. They can find an appointment. We saw a pretty high ratio of college kids come through last Saturday at our clinic. So that's part of the reason we're still going, is we want to make sure that the higher ed students have an opportunity here locally. It does seem like many of them got vaccinated at their home, their permanent residence, likely because the vaccine is probably easier to get there because uptake isn't as high as it is here. So we were glad to see that. But I know all three higher ed institutions are working to provide information on where boosters are available in the community. But yeah, they can absolutely get boosted here.
Shauna?
Yeah, so I am actually wearing a mask because my middle kid has COVID. And we found out Thursday, we were notified by the New York State Health Department. The first call noted that she was positive, and then I was very happy to receive a second call, which asked if we were able to safely quarantine her, as well as they made sure that we had plenty of food. So I certainly appreciate the fact that they're reaching out to people, as well as making sure that people have what they need to stay safe.
Yeah, it's good to hear, Sean. We do know that they're prioritizing under 18 and over 65 for contact. So I'm not surprised that you heard from them, but glad that you did. All right, if there's no other COVID questions, I'll jump over to the merger. Just wanted to give some updates on where we are, because things are going to start to pick up in the coming months on a couple of fronts, and we wanted you guys to be aware of that. First up, on the administrative side of things, so the kind of finance and admin issues, where we've been moving forward with the reorganization. We had several vacancies related to retirements, which has allowed us to kind of move more rapidly into the new structure. And so Brenda and Jeremy Porter have been working hard to recruit into the new positions. We've been fortunate to be able to do some promotions. We brought some new folks on board as well. And I think there's maybe one or two more positions to be filled, and that new structure will be really taking hold. So now their work shifts to how do we kind of reorganize the work across the two departments into one department. Karen Johnson, who some of you may know, has worked for the health department for many, many years, and we were happy to be able to promote her into a new role. So she's been spending a lot of time down at mental health, getting to know the state aid and contracting components of the work down there, so that she'll be able to support those efforts, for both functions. So that's exciting to see that going on. The next big step will be around the chart of accounts. So how our finances are booked. So we've been working with county admin and are setting up a series of meetings to talk with the finance department, to talk with the county attorney, and really start to put, pen to paper on what that will look like moving forward. We have to do that kind of first in line, because in order to use them for the 2023 budget, which is our plan, we really have to have them in place no later than May or June of this year, when we submit our budget to the county administrator. So while 2023 seems like a long ways away from a budget perspective, it's coming quickly. So a lot of work going on the admin side of things, which is exciting to see. There is also work. Christina is going to talk later about bylaw review. The Community Services Board has been going through their bylaws for several months now, looking at different parts and seeing what might need to be updated. The Board of Health will need to take a similar approach. I do think the Board of Health lift is a little lighter than the Community Services Board one, because there's a lot of non-merger related changes that the Community Services Board would like to make. But more to come on that. And then part of this chart of accounts conversation will also be charter update for the county, and figuring out what that process will look like, what needs to be reviewed and included, and kind of what a timeline for that might be. So, all of that is in the works, and there'll be more to come in later at this meeting and in future meetings about how that's unfolding. Another piece of the project that we're excited to see moving forward is our identity / branding work. around the new organization. And so we've had a cross-functional team that's been working on that for some time. They did put a RFP out to get professional support in that effort, and they've reviewed the applications, consulted with senior leadership team, and they're down to two or three finalists that they're going to be interviewing in the coming weeks. So we're getting closer to having some professional support to move that part of the process forward. And we are going to want to engage with the Board of Health, the Community Services Board, and the legislature to participate in that process. Yeah, ultimately, the legislature will have the final say on what the new department is called, because that is established in the charter. And so, they have the final say. And what we'd like to do is have some representation from these two boards and from the legislature in the process. So by the time it gets to you and to the legislature, there will be members that can talk about the process, how it went about, why we ended up where we were, and hopefully will help garner support for whatever evolves from that work. So wanted to give you a heads up that was coming. We're not ready to ask for particular help just yet, but we probably will be in the next couple of weeks. We plan to meet with Christina and Maria Morag, who's the chair of the CSB, to kind of talk through with them a process for identifying who might participate and what that will look like. And then we'll have more information after those conversations. But it's exciting stuff. And, we really are, starting to move forward with this work, albeit 2 years later than we had hoped. But it's good to be getting back to some of these things that are a bit more exciting for the team and all of us that have been working on it for a while. And that's all I had, Christina.
Okay, great. Thanks, Frank. Any questions or comments on all of that? Was a lot. So any follow-up? Okay, Sam.
Hi, everyone. Frank commented on things that I am also involved with between COVID and the strategic planning work. So the only other additions I had are that we closed the health educator position that we're recruiting for last week, but we do plan to reopen that a little bit longer. So I can alert people when that's posted again, because we're hoping to get a few more applicants. And then otherwise, we're just continuing to work on our community health worker initiative as well, and hope to post the job posting for those positions also in the coming weeks. So stay posted for those. And then lastly, just a big thank you to our health department team who's been working on the website migration, especially the environmental health team, that they've really helped with content transfer, and we're hoping by the end of the week to have content transferred, and then we'll be reviewing in the next week or two, and hopefully can go live to that new platform that Frank mentioned. So lots going on in addition to COVID. Thanks.
Thanks, Sam. Can you just talk a little bit more, because I noticed about a number of you had that website transition in your reports. So is it just a formatting difference, or is it something more substantial than that?
Yeah, so this new platform that the county has adopted, a lot of it is, the look of it, and that you can see if you go to the main county page or some other departments that they are already transitioned over, so you can see the differences in the view. But overall, this new platform is all ADA compliant, so it's just supposed to be much more accessible for everyone, and it's supposed to work much better on mobile devices so that the text adjusts and pages adjust. So it's much easier to look on a mobile device. So those are some of the big changes, but yeah, a lot of it is is similar. We're changing. It's a good opportunity for us to change some of our directory and our pages, a few of them that we want to combine and have, as a main landing page versus separated among the department. So.
Okay, great. Thanks. Just so everyone's sort of aware what's happening, that I think that's great that that's bringing the information up to date and into compliance with those. So, okay, great. Thanks. Okay, medical director report. Back to
you. Hi, good afternoon, everybody. There's a number of things that I would mention to you. And I think probably most importantly is where are we with this pandemic? I think as we look ahead to this coming year, that we can expect to see other variants arise. We haven't seen the last variant, is I think the judgment of most people. And so to look ahead and remain prepared for whatever may come our way, I think is an important issue. We seem to be, as I showed in the report, some drops in case reports and data in our state, although it's going to be a little bit more difficult to look at numbers and know, have a pulse feel the pulse of the epidemic if a number of our cases are coming from at-home testing, and we aren't always aware of all those at-home tests. The numerator as well as the denominator are affected, so we don't know about the negatives, we don't know the totality of the numbers, and we don't know about necessarily all the positives. Hospitalizations locally remain higher than they were, largely kind of hovering around the 20 mark, which was an uptick from December. The hope is that, as one would expect, with the 2-week period of time between being a case and ending up in the hospital, that those numbers would start to now ease back as we perceive that the Delta perhaps has gone through its peak, and many predict a very sharp decline. The data about it, according to what I heard this morning on a report, is that the breakdown of people being admitted with respect to vaccine status is not changed. So being unvaccinated puts one at high risk for severe disease. Being vaccinated continues to be an extremely important protective factor, although we know it doesn't protect against infection in general. Just this morning, I've had 2 inquiries about students, one in nursery school, one in public school, both of whom were very compliant with masking and who became cases. So we have a challenge perceiving school spread. We don't really have very hard data on it, but I think it points out going forward that this subject of masking is not going to go away. That until we get to a point that I'll allude to in a moment, continuing masking to protect against disease is going to be fundamentally necessary, along with being prudent about your gatherings, prudent about your distancing, prudent about your traveling and other such matters. So what is that future point? When do we transition from this being a pandemic to this being an endemic illness of relatively lesser importance? I'll be touching on this in much greater detail in my next bulletin or 2. And I believe that most of you on the Board of Health, if not all, have been receiving my bulletins for a few weeks now. This is an interesting subject. And the definitions, I believe, and Christina can correct me if I'm wrong, of pandemic, epidemic, endemic are not cut in stone necessarily. And there's a bit of wiggle room here, how those terms are applied. But I think it's important that we be on the same page pretty much in how these terms are used, and in, more importantly, in what they mean for us in public health, in terms of levels of intervention and concern of the public. So for me, at this point, to get to an endemic level is going to require global impact, and it's going to require impact on the treatment front, having treatments that mean something, that will be useful in situations where you're exposed to prevent illness, and then if you are ill, to preventing serious disease. And speaking of serious disease, let me touch for a moment on the 5-day rule for isolation and quarantine. And as I've done many times in these last couple of weeks, I want to emphasize that that 5-day rule only applies to otherwise healthy individuals at relatively low risk for having themselves remain contagious for prolonged periods of time. So who aren't in those groups? And of course, those are the immunocompromised individuals and the people who have had very severe disease. Those folks may remain contagious longer. We at the department are currently continuing to look at people being discharged from hospital to determine whether they need a longer isolation. There are cases that come up that are not hospitalized individuals, but who have special circumstances, and we continue to review those. Those folks, we often have to interact with their healthcare practitioners in order to coordinate what makes sense for them. So we are, at this point in time, continuing to do those things. In terms of vaccines, the latest I've seen is that Pfizer is working, as you know, on a Omicron-specific vaccine. It looks as though it wouldn't be before March that such a vaccine would be available. And one certainly would have to question its value at that point. There may be value for certain target populations. But I think at this point, it would be, if Omicron runs the way other variants have, it would be hard to see it playing a major role in our general public health campaign. More importantly, I believe, is the vaccine for under 5. And all 3 companies, of course, are working on this. Pfizer looks as though it will be potentially having something to put before the FDA in March. So it looks like it's meeting that sort of expectation that we had as of late fall, that it would be first quarter of this year and going into the second quarter of this year before we're able to really vaccinate that group of individuals. I hope that remains the case. A lot hinges on how things work out in the clinical trials that are being run for the under 5-year-old age group. And just to remind you all that the Pfizer vaccine objective was to use the lowest possible dose of the vaccine in its product. Unfortunately, that lowest dose, when you ran through the rest of the clinical trial, did not elicit the antibody levels that they were anticipating. And so they had to go on to a different plan B. We'll see what that looks like when it comes out. And then it'll remain for the FDA and the CDC, of course, to go farther. I want to change and just take one more minute and talk about a different topic. And I want to talk about tetrahydrocannabinol. or THC, or what is being called by the Office of Cannabis Management adult use cannabis. Shauna Black shared around the county a upcoming webinar being put out by the Office of Cannabis Management to inform the public about what the Marijuana Regulation and Taxation Act, or otherwise called MRTA, encompasses and what its objectives are to be achieved. I think it's very important for us to be aware of that law. It covers not only medical marijuana, but also what's called hemp cannabinoids, which are largely CBD products that are already being marketed retail-wise, but it seeks to regulate that market more carefully. The THC is more what concerns us in terms of overdoses and traffic issues and other problems such as children accidentally ingesting and ending up in emergency rooms and calling poison control. I just happened to have been involved with a meeting with the Office of Cannabis Management, not in my role as medical director, but in my role as a family physician. And I think I was pleased with the expertise that they say they have, with the plans that they have for a public education campaign. But I think we need to be in there pitching hard to make sure what we see as optimal rollout hopefully is achieved and we avoid mistakes that other states have made. The first effort in their public education campaign is this series of cannabis conversations that they call them, that will be in February. We were able to have a good dialogue on that call about packaging of these products, what's called child-resistant packaging, concentrations of the product and what is in each serving portion. We're told that the regulations and the rules, which largely are where the rubber meets the road with regard to these things, will take about 18 to 24 months to actually be created and then put into effect. So there is time in here to comment and to urge as we go forward. I'll stop there. Thank you. I've probably taken more than I should in terms of time, but if there are questions, please.
Thank you so much for all of that. So maybe one just quick question before I open it to everybody else. Did you say, Shauna, is there a webinar that you said is available? And if so, is it possible to just send that around to all the board members in case anybody is interested in attending? Dr. Claypack, I don't know do you know when that is, or?
I believe the one for Central New York, which is the area our county falls in, is in, I believe it's February 7.
Okay.
And they're at 6 p.m., I believe.
Okay.
My car's not set up yet.
Okay. Any other, so if Shauna can send that around, or if you have it, if you're willing to share that, that would be great with the board members, or even if the public is interested, if it's something that can just get put into the chat so that folks can see it.
Shauna, I'm sure, has her plate full with her new position. Congratulations, Shauna.
Yes.
Let me forward it on to Karen, and Karen then can get it.
Great, thanks.
Sorry. I actually just forwarded it to Karen.
Okay, perfect. Thank you.
Thank you.
Melissa.
Dr. Claypack, I was in New York City this weekend and walking down the street, and they were selling THC products on the street. And a lot of the packaging were very, very enticing for kids, so there are things that look like Fritos and Oreos. And I'm wondering how we can stop that packaging, and what I feel like it's something the AAP should get involved with sooner rather than later, because the packaging isn't labeled very clearly.
It's not legal to market THC as such at this time. So if they were, that's in violation. If they were marketing hemp cannabinoids, which usually are a combination of THC with CBD, that is legal. And the regulations that were put in the register in New York State in late November address some of those packaging issues, et cetera. I would expect that if all goes according to Hoyle, the way it should, that we would see some of that stop. It's precisely what you bring up: the labeling, the declaration of what's in this product, the enticement of underage people to use it by virtue of how the product looks. Those are all the issues that the New York State Academy of Pediatricians should weigh in on. The Academy of Family Physicians has already, and I'm sure I wouldn't be surprised if the New York State Academy of Pediatricians has as well, although I don't know for sure. I must say that some other professional societies are sort of intent on beating back the legalization of THC, which is a fait accompli. And I've tried to urge them instead to weigh in on rules and regulations, put their efforts there. I think that's where they would be better placed.
Are you all set, Melissa? Okay, thank you for that. Ed, and then Shauna.
Yeah. So Bill, on the hemp products that are currently sold at this point, or the CBD products rather, is the THC content regulated on those at this point?
Yes, the new regulation limits the THC content to be no more than 0.3%, I believe.
Okay, right. That's what I thought. Okay.
Yeah. So
I was just curious because when I went to get my Chinese food down by Elmira Road, there's a shop there that seems extraordinarily busy, much busier than I would have thought, a CBD shop. And I didn't know if there was something that was changing in their product percentages.
Yeah.
Okay.
Well, certainly the indications for CBD have been kind of, the barn door has been opened wide. Even though when I last looked at this in the last couple of weeks, the data surrounding CBD scientifically only shows a very limited number of proven indications, but the barn door really has been opened terribly widely.
Thanks.
Okay, Shauna.
Yeah, I feel like obviously the sooner we can regulate this, the safer it's going to be. I'm wondering, I know that what happened in Washington, D.C., as well as Massachusetts, is that before they were able to regulate, there were groups that were selling stickers or bags and would include a marijuana product with it. And I'm wondering if we've seen any of that here in Tompkins.
I certainly haven't heard of any. I don't know if Frank or Liz have. Liz got her hand up.
We did get a couple of inquiries about that. I don't think they were from you, Shauna. They were a bit ago. And it is not, they were selling stickers that would then, if you bought the sticker, you would get this along with it, right, to try to bypass. And it was determined that that was not legal, and we did relay that information to them. We haven't heard anything for quite a bit, to my knowledge, since then. That was early on when this started.
There was an event that just happened, I think this past weekend at Lake Watch Inn, where they sold tickets to the event. And then there were, as I understand it, there was sampling inside. So they weren't selling product, they were selling the event. And that was their way of working around it. There was articles in both the Voice and the Ithaca Journal announcing it.
Is that legal?
The sheriff was quoted in the articles, so I would refer legality questions to him or the county attorney.
Okay. Other questions? And just if you're not paying attention to the chat, thank you, Frank, for putting the links in there. And you have a couple of different choices. It looks like they're running a number of webinars, which I assume will be similar in content. So, you know, choose something that fits for you if you're interested. Okay. So Claire, I think you are up next. Did we lose
Hello,
Claire? Oh, no,
everyone.
you shifted on me. Okay. Hi, Claire.
Here I am. Okay, so yeah, COVID dominated our time and our resources in November and December. I think Frank and Dr. K gave a really good synopsis of where we are. I did want to mention it's not something we took for granted. We had a lot of support from the other divisions within the health department during that time, from health promotion, CSCN, environmental health, and the admin teams, in addition to all the other work that they were doing. So that was really critical for us to move through that phase, and that's all winding down now this month. We're working with the state, as Frank said, to address our case investigations and the support that people may need in order to safely isolate or quarantine. We're working with them more on quality control and messaging. And we're also still fielding questions and inquiries from the public if they need further information. Shauna, I do apologize. I'm sorry that your child has COVID, and at least encourage that you had a positive experience with the health department and following up on that. So that's good feedback. As we move towards self-management of COVID, at the same time that guidance is becoming more complex and there's new guidance coming out all the time, it just kind of highlights to us the need for communication. And we're also trying to develop an approach to engage stakeholders that are managing or operating in higher risk settings, so that they have the help and the support they need to understand the guidance for their staff, or their residents, or their clients, students, for example, in congregate settings, or daycares is another example. And so we're working on that. I think there's been a lot of changes in the month of January, and we're scaling down, shifting our approach, and we'll cover all those details in our next report. So besides that, I would just say that everyone in the division is excited to move back to our other community health work. We do have a position open for a community health nurse that's going to focus on communicable disease work, replacing Nanette Scogan, who retired at the end of December. She will stay on for 1 day a week for the next 3 months to help us with that transition. So I don't have any other additions to the report for now, but yeah.
Thank you, Claire, so much. Anybody, we're gonna lose Ravinder. What time do you have to leave, Ravinder, right now?
Yeah, I have class at 1 p.m. so I can stick around until like 12:55, I guess.
Okay, Frank, is it okay for me to put a hold on reports and let's
Yeah.
shift to things that we need voting on?
Yes, please.
So let me flip down to our environmental health administrative actions for everyone. Sorry for the abrupt shift. Claire, I'll come back
Sorry
for
about
questions
that.
for you. No, it's fine. Thank you for giving me the heads up. So let's go ahead down to our first, hold on one second. Let me just, it's about Gaggle Company, which was I think a sewer permit or sewage system permit issue or septic system permit. Am I getting close, Liz? Hold on.
That's correct.
Right. Okay.
This was one of the few that went to hearing. So we had a hearing, there's hearing officers reports. He installed a sewage system without a permit and it crossed property lines. So we're charging $500 and he can't do it again.
Okay, so let's just hold on any additional discussion. So if we could get a motion on this to approve as written. Okay, a first from Melissa,
Or a second.
a second from Ravinder. Okay, so let's go ahead and open for discussion. So Liz has already given a little bit of an overview. This went to hearing. I think this is the first one we've seen like this in a while. Liz, can you just take 2 seconds to explain what that means?
Essentially, that means that the Kim Wetzel would not sign the draft resolution or the stipulation agreement that we had issued. And when they won't sign the stipulation agreement, we then have to go to an administrative hearing and then present the resolution to you that supports the hearing findings afterward.
Okay, great. Thank you. So are there any additional questions on this discussion? Okay, so all in favor is written. Okay, any abstentions? I'm sorry, and any opposed? Sorry, I did that in the wrong order. I think that's everybody. Okay, I think that was unanimous. All right, so moving to the next one, which is the cactus heads enforcement. I think there's a couple here, I think that are related to farmers market vendors. So cactus heads, if someone can kick us off with a motion here to approve as written. Shauna, first from Shauna. Need a second? I'll have us take a second from Samara. Okay, Liz, can you just give us a brief overview of this? Is there anything?
This was a out of temperature milk and dairy products were out of temperature during 2 inspections. So it's our standard fine and orders.
Any additional questions on this one? Okay, all in favor is written. All opposed? I think that was unanimous. And abstentions? All right, our next one is related to macro mamas. And so if we could get a motion to approve as written. From Melissa. I'll need a second from somebody. A second from Shauna. Okay, Liz, anything additional here that we need to be aware of? Okay.
No, this one was hot food out of temperature.
Yep. Any other questions on this one or comments? All right, all in favor is written. All opposed? I think that was unanimous again. Abstentions? I don't think there's any. Okay, great. Okay, the last one is for, I think I'm on the last one. Nope, second to last one. Old Mexico. Okay. First here, our motion as to approve as written. From Shauna. Need a second. From Melissa. Okay, Liz. Any additional? Okay, go ahead.
We brought Old Mexico previously to the Board of Health for a malfunctioning equipment. They fixed that. They had something else malfunctioning this time and they weren't checking temperatures. So they had food out of temperature. And so they have a higher fine as a consequence.
Any questions or comments on this one? Okay, everyone in favor as written? Anyone opposed? That's everybody. Abstention? Okay, unanimous. Okay, last one is related to the Taste of Thai Express, which is a little bit of a doozy on this one. Okay, so approval as written. Need a first from somebody here or a motion from Shauna. Second from Samara. Okay, Liz, anything in addition to what you've already provided that we need to discuss? It's just it's a big one, so.
Yes, they've been to Board of Health multiple times. So this is bringing them back once again. We have been in consultation with them once in addition to during the inspections. And I just today, or possibly yesterday, have requested another meeting. So maybe we're getting their attention now. But yes, it's been a very difficult, challenging situation with multiple violations.
Yeah. Okay, any questions or comments on what's written here? Shauna?
Yeah, have we offered interpretation to some of their kitchen staff?
Yes, normally, yes, we certainly make sure that whatever we're communicating can be communicated. We don't always communicate directly with these staff, but we try to make sure that they can do that. We have materials in various languages, and we can provide interpretive services. We certainly make sure that we've been in touch with the manager and address any communication issues there. So we do everything we can to ensure it's not a communication issue. There's also lots of turnover and a lot of other factors affecting restaurants these days that are an equal challenge, I think.
Any other questions or concerns? All in favor is written. All opposed and abstentions. I think that was unanimous again. Okay, so Ravinder, just one more thing real quick before we let you jump off is that can we, Frank, on the medical director reapproval. So I'm assuming okay, go ahead.
Yeah, so every 2 years, we have to appoint a medical director for the department after having his credentialing reviewed by Kaga Health Systems, as we do every cycle, and consulting with Dr. Claypack. I am happy to bring his name forward for another 2-year appointment for your approval.
Okay, great. So is there someone who can make a motion for us to reapprove Dr. Claypack?
I can.
You can't nominate yourself.
No, I was going to offer to step out.
No. So Melissa, I think I saw your hand up. Okay, do we have a second for this? Okay, Ravinder, all in, any discussion? Okay, all in favor of reappointment? Okay, I think that was unanimous. Did I miss anybody? Any opposition or abstentions? No. Congratulations, Dr. Claypack. You're stuck with us for another 2 years.
Well, thank you. It's gratifying to have friends.
Yeah. Ravinder, thank you so much for holding in
Yeah,
there
of
for
course.
us.
Sorry
Good
to
luck with
leave.
class. Yes.
Thank you. Bye.
Yes. Bye-bye. Okay. Let me jump back to Claire, who had just provided us with a great summary, and sorry for sort of rudely jumping away from you, but are there any additional follow-up questions for Claire on her presentation? Or anything? Okay. All right. Deb, children with special health care needs.
I just wanted to add one addition to my report. We're starting to experience a big shortage of speech therapists. We have in Tompkins County right now, we have 50 plus children on a wait list for speech therapy. We've never seen this kind of shortage before in Tompkins County. We might experience a small wait list and we usually get it covered, but I'm reaching out to agencies. I've reached out to the state, and this is a nationwide problem, but there's just really a lot of difficulty for the agency finding speech therapists. I just wanted to let you know, in case you hear from parents, please give them my number to call and I'll try to talk to them about this. But I just wanted you to know.
Thanks, Deb. Thank you for letting me know that too as well, because we have a speech language program here. So it's good to understand that there's a local shortage as well. Okay, any questions for Deb? Comments? Yes, Sue.
Yeah, I just noticed that the numbers for 2021 were high relative to 2022, just kind of overall. Is that because 2020, I mean, 2021 is higher than 2020? Is that because 2020 was repressed and now we're back to normal, or has this been a high year?
We think the numbers were down all last year due to COVID, and I think a lot of parents weren't taking their kids in for physician appointments as often, and we're just starting to see the effects from that.
Yeah. Okay, thanks. Any other questions or comments for Deb? Our county attorney, are they on? I don't think I remember. Did they join?
No, Bill's not
Okay.
here.
Yeah, okay. Liz, anything in addition in your to your environmental health report?
I don't have anything to add.
Any questions for Liz on her report? Okay. And then Harmony, thank you for being here. Anything, or Frank, or if someone attended the CSB, anything from that side in addition to the bylaw question for discussion?
You know, there was a bylaw discussion. I don't remember what else was on the agenda, to be honest with you, Harmony.
Well, Maria Morag did become the new chair, and there was a discussion around how to improve the election process for subcommittees with a hope of maybe piloting a different process this year. And then if that works well, then that can be added to the bylaws. And then they also were focusing on what kind of agenda items they wanted in this year. That's pretty much it.
Okay. Any questions on that at all? Comments? Okay, so just to finish up, and since we're on the topic of coordination with CSB, if we can talk real quick just about the bylaw process. So I think what we need is, so I will be involved. So this is not me saying I need somebody else to do it. So I'll be part of this process, but it would be really helpful for me if I'm not the only Board of Health member having this discussion, because I think it's a process, at least when we were talking through even the merger pieces, that was really helpful to have multiple perspectives as we think about what adjustments might need to be made to the Board of Health bylaws. I think, as Frank alluded to, I don't think our lift is quite as heavy or not as extensive as perhaps what might be done on the CSB side, but we do have some work to do. And I think we need a few people who are willing to actually sit and work with the CSB members as we sort of negotiate back and forth what's the right language to be in both of these bylaws. So I'm sort of hoping that there's somebody on the Board of Health, including the two who aren't technically Board of Health members yet, but will be in the next month. If there's at least one or two other people who might be willing to work kind of outside of our regular Board of Health meetings, and potentially go to maybe one or two more meetings where we can meet with those folks and kind of bring the two boards together. So it's going to be important work. Does anybody who has bandwidth and interest, and if you need some time to think about it and get back to me, that's fine as well. But we really do need some. We are going to need some additional input. Okay. Okay. Well, Frank.
Christine, you think it really is a couple of meetings? Or was that?
I mean, I think so. Like, I think we need to meet with them at least once, where we're talking, actually talking with each other about what sort of the direction is. My guess is that we can probably solve a lot more after that just by emails and reviewing documents and making edits and things. But I think it's going to be hard not to have at least one meeting where we have at least an initial discussion with them about sort of the framework and strategy of what direction we want to head.
Okay, so if and when I get approved to be on the board, I'd be willing to help out with that.
Okay, Sue, thank you so much. Okay. And Frank just put the bylaws into our bylaws into the chat, so you can take a look at those. And actually, Frank, do you happen to have the CSB bylaws, or Harmony, do you have the CSB bylaws? Could somebody send those around to us as well, or at least to Sue and I, so that we know what we're doing before we get into the meeting?
Yeah, we can get those to you.
Okay, great. Thank you. All right. And if anybody else, when you get off, really realizes that you really want to hang out with Sue and I a little bit more and work on the bylaws, just send me an email and let me know. Okay. Otherwise, Frank, I think we have covered everything on the agenda. Oh, I forgot to get Ravinder to help with approval of the minutes.
That's okay. We can do those again.
Okay. So close to perfection, but I forgot. All right. Anything else for the good of the group before we adjourn for the month? Okay, great. Everybody have a great month, and we'll see you in February. Okay, bye-bye.